Ever thought about how a microscopic parasite, one of the most common on Earth, could just quietly invade your body and actually threaten your vision? Well, today, that's exactly what we're diving into, a condition called toxoplasma retinochoroiditis. It's all about an unseen invader that can cause some really serious damage to the back of your eye.
So, here's our plan. We're going to start by looking at what this infection actually looks like inside the eye. Then we'll get to know the parasite that's responsible, figure out how it gets in, see the kind of damage it can do, and finally, look at how doctors fight back to save a person's sight. All right, first up, what does this invasion really look like? You know, when this parasite finally decides to make its presence known, it creates this incredibly dramatic and honestly alarming scene inside the human eye. And, well, doctors have a pretty memorable name for it. To an eye doctor, an active infection can look just like this, a headlight in the fog. It's such a powerful and kind of weird image, right? So what on earth is actually causing this to happen?
And the answer is a really intense, localized inflammation at the back of the eye. What you're looking at right here is a real-life example. That bright, hazy spot, that's the headlight. It's an active infection on the retina. And the fog all around it? That's from inflammatory cells clouding up the vitreous, which is the clear gel that fills up your eyeball.
So who's the microscopic culprit behind all this? Let's take a closer look at the organism responsible, because it leads this absolutely fascinating and pretty complex double life. Meet Toxoplasma gondii. It's a tiny, single-celled parasite, and its whole life cycle has this really specific connection to cats. See, cats are what scientists call the definitive host, which just means they're the only animal where this parasite can sexually reproduce. Now, this parasite is a true master of disguise. It actually changes its form to survive. It starts out as something called an oocyst, which is often found in the environment from cat feces. But once it gets inside a host, it morphs into a tachyzoid. This is the active, fast-multiplying form that causes the acute infection. But here's its real survival trick. It can become a bradyzoid. Think of it like a sleeper agent that walls itself off in these tiny cysts, just hiding out, dormant in our brain, our muscles, and yep, even our retinas, just waiting for a chance to wake up. And here it is. This is the parasite itself seen through an electron microscope. For a single-celled organism, its structure is just incredibly complex. And it's that complexity that lets it pull off its ultimate trick, hiding dormant inside those cysts for years, only to reactivate later and cause infections all over again. It's basically perfectly evolved for a long-term invasion. Okay, so we know what this parasite is and the kind of trouble it can cause. But how does it get inside the human body in the first place? Well, it turns out there are two main ways.
You can think of it like two main highways for infection. The first is congenital, which is where an infected mother passes the parasite to her unborn child right through the placenta. The second path, and the one that's more common for many people, is postnatal. That just means we pick it up from the environment at some point after we're born.
So how does that postnatal infection happen? Usually in pretty everyday ways. It could be from accidentally swallowing the oocysts from contaminated soil, maybe while gardening or from not washing vegetables well enough. Or it could be from eating undercooked meat from an animal that was already infected. The other ways, like through blood transfusions, are thankfully a lot less common. 65%. That number is huge. That's roughly the rate of recurrence for this infection. It means that once you have it, that sleeper agent parasite can lie dormant for years and then just wake up and cause trouble all over again. And it doesn't matter how you got infected in the first place. So, what are the long-term consequences of these attacks? Let's take a look at the permanent footprint this parasite, and our body's own fight against it, can leave on the really delicate tissue of the retina. And we're back to that powerful description. As this quote explains, the headlight is that focused spot of inflammation right on the retina itself. And the fog comes from what's called severe vitritis. Basically, a cloud of inflammatory cells in the eye's clear gel, which literally makes a person's vision foggy. So after the immune system finally wins the battle against an active infection, it doesn't just pack up and leave. The intense inflammation leaves behind a permanent mark, a chorioretinal scar. And over time, this damage can create a really distinctive wagon wheel pattern on the retina. And this is what that scarring looks like. This is the permanent footprint left behind by a past infection. Any part of the retina that's covered by this scar tissue is permanently damaged, which creates a blind spot in that person's vision forever. This comparison is just a brilliant illustration of why getting treatment early is so critical. On the left, you've got an active lesion, that bright headlight. Now look to the right. That's the same eye after treatment. The inflammation is gone, and yeah, there's still a scar, but it's way smaller. Less damage means more vision is saved. Simple as that.
Okay, so what's the game plan if you're diagnosed? The good news is medicine has a pretty solid, multi-pronged counterattack that's designed to save as much of your vision as possible.
The treatment plan has 5 really clear goals. It's about way more than just killing the parasite. Doctors are aiming to relieve the symptoms, get the infection under control, prevent damage from your own body's inflammatory response, stop it from coming back, and then ultimately help rehabilitate a patient's vision.
The main strategy is usually a cocktail of drugs. You've got the classic triple therapy, for example, which combines 2 anti-parasitic drugs with a corticosteroid, so you're fighting both the bug and the inflammation. But because that therapy can have some tough side effects, doctors also have other effective options, like the antibiotic combo Septrin, which can be a little easier for patients to handle.
And here's where you see the really delicate balancing act of the treatment. Steroids are amazing at fighting inflammation, but they also suppress your immune system, so doctors have to be super careful with them. They'll typically only use them when an infection is threatening the most critical parts of your sight, like the macula, the part responsible for all your sharp central vision. It's a calculated risk, really, using one drug to stop your own immune system from doing more damage than the parasite itself.
So there you have it, from a simple parasite linked to cats all the way to a sight-threatening headlight in the fog. It's a really powerful reminder of the complex, microscopic world that's all around us. It definitely makes you wonder what other amazing connections between our health and our environment are still out there, just hiding in plain sight.